with that paper, we prove that we can do telepsychiatry. That paper proves that it can be done, because if you're going to look before that, you cannot find any reference for an actual performance of telepsychiatry in the country. So with that paper, it shows that it can be done.
Alright, for the second paper, the acceptability of telepsychiatry in OFWs in Kuwait, it involved a study with a different setting. The first study was in the Philippines and involving Philippine culture, but this time it involved a different setting, a different country, and for obvious reasons, different cultures. And it also was a success, and it really proved that in that specific region, the acceptability of telepsychiatric care is also feasible and is very much needed for our OFW countrymen.
Welcome to the Behind the Science podcast, kung saan kakausapin natin ang ating mga scientists para ibahagi hindi lang ang mga resulta ng kanilang pag-aaral, kundi pati na rin ang mga behind the scenes or behind the science stories nito. Ang podcast na ito ay in partnership with the University of the Philippines Resilience Institute and the Philippine Journal of Science. Today, we have our guests, Ms. Cristela Candelario, Mr. Gregorio Candelario, Dr. Ismael Cordero, Dr. Reagan Joseph Villanueva, and Dr. Maria Angelica C. Plata.
Very honored tayo ngayon, no, Drew, kasi yung lahat ng authors ng paper na i-discuss natin today ay andito. So, ayun. So, siguro, we can start.
First time.
Oo nga, first time. Nagulat din ako na parang. But it's a very exciting first time for us to be interviewing not just one, not two, but of course, all 5 co-authors for the paper na ating pag-uusapan today. But before we go into the paper itself, let's magbalik tanaw tayo, no? Let's interview our guests and tanungin natin yung kanilang childhood or siguro yung younger years nila during their start working here sa ating research sector or in the science sector itself. So let's first go to Doc Laika. Kailan nyo po na-realize na gusto nyo mag-work sa science sector?
When did I decide? Siguro po when I was in the science sector kasi my pre-medical course is nursing. So siguro at that time pa lang when I was in college, in high school, no? Because you have to decide what course. And at that time, nursing was really popular at that time. And then yung gusto ng parents for me. And I also love science at that time. So I went into nursing. And then afterwards, I also pursued medicine. So siguro it was around in high school.
Okay, so ayun po. So nursing pala ang background nyo, no? Dr. Laika. So, ano ba? Parang ever since bata pa lang kayo, no? Parang gusto nyo na po ba maging doktor ever since bata kayo?
Actually, yung originally talaga, yung ate ko yung mag-medicine when we were younger. But when she decided not to pursue medicine, ako na po yung, sinabihan ko na po yung parents ko na, pwede bang ako na lang mag-medicine? Yun po.
Okay po. So, ayun pala ang inyong origin story. Ayun. So, thank you.
Family of healthcare workers with Basel.
Oo nga eh. So, thank you, Doc Laika. So, siguro since same screen naman po, we can go to Doc RJ na siguro. Same question. Kailan nyo po na-realize na gusto nyo mag-work sa science sector?
Siguro you working in science, no? An undergraduate course ko is biology. So science based talaga siya. Then working sa research naman, we dati I participated sa isang conference where we presented a paper, and then yun yung first entry ko sa paper in presentation form. But after that, when I proceeded to medicine, I sinabay ko na. I go sa medical school. At the same time, I started writing scientific papers, not in medicine, but yung hangover ng BS Biology. So, yung BS Bio ng mga papers ko, that was way back in 2005. So, yun yung mga BS Bio papers ko. So, I think yun yung initial entry ko sa science field. So, from BS Bio, then going to medicine, hindi ko binitawan si BS Bio. So, I still produce paper for biology. And then I started going to medical school, then doing some research in medicine. And ito, so nasabay na siya, BS Bio sa medical research.
Ayun, so very naman po pala, multitasker. No, si Doc RJ. Pero that's a very interesting way, no? Parang first time ko po nakarinig ng sabay, like nagme-med and then you can still produce papers from your original field. So that's very commendable po, Sir Doc RJ. So same question po, Doc June.
Again, good evening sa ating viewers and sa everyone who's watching. As for me naman, my parents encourage all of us, my siblings and I, early on pa during our elementary to go to sa science-related courses. My dad is a physician, and mom is a teacher. But both of them encourage me and two of my sisters to go into medicine. Unfortunately, my sisters shifted into nursing, so I was the one who was left to go proceed to medicine. So, doon ako na-encourage na delve into science-related na endeavors. Now, in terms of research, my siguro most significant exposure was in my college years in my BS Biology. Together with my research group, we were able to present a study that was qualified for the DPI Science Awards when you were back in Dinelio. But that was way back pa. So, those were my first experiences with science itself.
Grabe yun, sir. BPI DOST awardee. Grabe. parang ako personally, pinangarap ko lang na makaganyan. Kahit maka-attend man lang. Pero unfortunately, it's not in my cards. But sir, that's a very commendable and important feat na naranasan ninyo, sir. So, congratulations on that. And yeah, thank you for continuing research kahit you're practicing medicine. Kasi syempre, alam naman po natin na medicine is continuously evolving. So now, let's go to Sir Greg.
Okay, good evening to all the viewers. Good evening, Keith and group. Very good question.
Good evening po.
And I think when I was in grade 5, my father told me that for as long as I live, my idea for you is to become a doctor, medical doctor. And when I reached high school, talagang I'm excited to learn science. And I remember when I was in second year high school, talagang nag-champion ako doon sa school namin from first year to fourth year. And that was 1976. I won 10 pesos. Yung pansik mami noon is just 2 pesos. So from Monday to Friday, talagang kumain ako ng pansik mami. This is my favorite. But unfortunately, my father died. After na-paralyzed pa siya, I graduated in high school. And then I shifted to civil engineering dahil walang scholarship at the time sa medicine ng po ako. So, but I managed to get the study now pay later of Bini Aquino before. And that was just, I think, 1 year. And then after that, I was hired as a scholar in the university. And then with allowance pa, prevision. So, tinuloy ko na yung pani. Yung civil engineering po. But initially, when I was in high school, yun ang nagpatrigger sa akin because I had to develop other concentrate on things is science as I move forward at the time. Yun na po.
Ayun, so thank you Sir Greg. Ayan, very napapansin ko sa lahat na nai-interview natin, no, they start getting an appreciation with science at a very young age, di ba, Drew?
Yeah.
Parang
Totoo.
we-
Parang mga preschool, grade school, ganyan. Ganong levels.
So, syempre, last but not the least, we have Ma'am Ella. Can you tell us a bit more of how you got into the science sector?
How much time do you have? Pero I was all in science way back when pa, elementary years, I started to compete in science quiz bees, quiz shows. And then pagdating na high school, I wanted to become a doctor. Yung mga cliche na mga na mga what do you want to become when you grow up, mga ganon. So, but I always centered myself on science field. And so, come college level, sabi nila one of the best pre-med courses daw yung medtech. So that's what I applied to, and sa awat ng Diyos pumasa naman. So pagdating lang ng fourth year level during internship, makita po kung gaano kahirap pala yung hospital duties, and for health reasons as well, naisip ko na hindi siya bagay for. But my love for science still remained all throughout. So sabi ko, ang ganda naman din pagiging tech. You're a scientist, you're working in the lab. And nawili na rin ako sa research, and that's why after graduating and working as a medtech for 4 years, I pursued my master's degree. And then after that, I was exposed to doing research. My mentors were really very giving and very inspiring. And after graduating my master's degree, kinuha na nila ako sa academe. That's why I ended up being an assistant professor as well. And so, after several years of teaching, meron talagang naiiwan na longing to always learn, to always pursue science and research. And that's why I'm currently taking my doctorate degree in public health. So, yun, from a medtech to public health, that's how I ended up in the science. Thank you.
So, thank you, Ma'am Ella. So, Ma'am, curious lang po ako. May relation po ba kayo ni Sir Greg? Kasi,
Actually,
na-curious ako.
He's my father.
si Candelario.
Is my sister.
Oh!
So, it's a family.
Wow.
Wow.
Ako yung ate na hindi na pursue ng med na ako na lang.
Oh my God!
Okay.
Trivia.
Amazing.
Oh my God!
There you go.
Yung papers, it's actually a family paper. Ganyan. Amazing.
Ang saya.
Actually po, kaya po i-compile today because we just came from an event, also another research funded by the OST. It's telepsychiatry for OFW. So we talked with stakeholders and different agencies just a while ago lang po. At medyo jam-packed po yung day na niya. But we're really thankful for the opportunity.
Oh my God. We're very thankful din po. Medyo na-shock din ako. Parang, oh my God, this is a first for the podcast.
Yeah.
Ang
Ang daming first actually.
like,
for this episode.
ang saya lang po, like, to see a family who supports and cherishes the kids na mag-pursue ng science. Kasi what we really need right now are more scientists and more people in the science sector, and to see your family na who kita mo yung love for science, kasi 2 generations like father and daughters Ang saya. Ang saya ko. Okay na ako.
Amazing. Okay.
Pero ayun, thank you very much po for sharing your stories with regards to how you came up or paano kayo nag-arrive sa science sector. So now, siguro Drew, pwede na nating pag-usapan yung papers ni na Doc and Ma'am and Sirs. So,
Yeah. Pero before that,
ay, okay.
lahat naman po kayo nasa nasa parang psychiatry field, no? So ngayon po kasi sa mga podcasts, may growing popularity yung mga self-help podcasts. So ano po yung thoughts nyo sa mga ganitong types of content? Tingin nyo po ba nakakatulong din siya to improve the mental health of the people listening to it?
Okay, so talking about self-help na mga podcast, no? Yes, it will help, no? They help, no? Considering the lack of or the limited na manpower in especially sa mental health care na side, no? Limited ang service provider, no? Itong mga self-help, no? Many of them experience-based, no? So they do help a lot, no? And then most of our users, no, or mga service users natin, mas madali kasi nila mag-link with this self-help people, no? Kasi more or less experience-wise, it's just easy to connect, no? But for some, no, it helps. But minsan talaga umaabot sa point na hindi na talaga kaya. So that's the time they need professionals to address their concerns, no. But yes, walang problema po sa mga nag-increase na numbers ng mga self-help, no. Kasi for some people, no, they join, no, they listen to it. And then they try to practice that in their own buhay. That if it will not work, and they will look another self-help, no? So yun yung nangyayari ngayon, no? So
Wow.
they seek some reference, no? They try to practice that reference. If it will not work, then they look to another, and if it will not work, then they look to another, no? And then kaya nga sa psychiatry minsan bago dumating sa amin, marami nang na-experience, no? Marami na din silang alam. So when they go to us, it's not just them telling their experience, no? But sometimes many of them also ask questions, no? How about this? How about that? Kasi nagbabasa din sila, no? Nagbabasa sila and they listen to sa mga recordings, no, sa mga videos, no. So that more or less increase awareness, increase the parang yung stigma mawawala, no. It's a good, no. For me, wala akong negative comment doon. It is a additional help sa limited na mental health care service providers.
Oh, okay.
Thank you po
Thank
for
you po.
answering a very curious question. Shut up. Nabanggit niyo po pala yung sa stigma. Sorry, pero question lang po. Parang sa ngayon po ba, parang nararamdaman niyo pa rin yung ganon, yung pagkakaroon ng stigma where it comes to mental health, or is it really getting better?
Concerning sa stigma, if you're based sa observations, no, based sa kasi sa areas na pinupuntahan namin, bumababa naman, no. Parang there's already an improvement and awareness sa mga tao. But if you're going to compare rural and urban, mas mabilis ang de-stigmatization sa urban, kayong rural naiiwan pa rin, no? Meron pa rin silang stigma, no? Then in terms of age group, mas mabilis ang de-stigmatization sa younger population. So yung mga millennials ngayon, mas open sila sa mental health. Kaya nga battle cry nila sa, 'di ba, sa workplace, mental health parade, no? Battle cry nila 'yon. Kasi yun yung sa millennials. Pero pag tatanungin mo yung mga baby boomers, ibang usapan na naman yun, no? Kasi mas maraming member doon na medyo still there.
Ah.
The stigma is still there.
I think with the help of technology din and social media na yun nga, mas na-demystify yung mental health na erasing taboo little by little.
At least,
Yeah,
di ba,
that's
ano,
great.
parang
Mhm.
it's slowly, we're getting there.
Yeah.
We're getting there. And hopefully, mas maging accessible pa po ang mental health education as well as treatment dito sa Pilipinas. Not only in the urban areas, but sana siguro pati not rural areas. Para at least ano talaga siya, we can like erase the stigma or lessen lalo if not totally erase. So ayan, thank you very much po. Ang aming mga curious
So,
question.
actually, so speaking of yung pagiging abot kamay ng mental health tawag dito. Yung pagiging abot kamay ng mental health care. Ganyan. So let's move on to your paper. So today we'll be featuring not just one but two papers. So yung first ay yung telepsychiatry enables better mental health care access in a southern Philippines hospital, a mixed methods outcome evaluation. And yung second paper ay yung acceptability of telepsychiatry among overseas Filipino workers in Kuwait. So, ma'ams and sirs, can you explain your paper in one sentence?
So for one statement for the paper, no? So for telepsychiatry in Southern Philippines Medical Center, done in the Southern Philippines Medical Center, I will say in one word, no, it's a success. It's success. Because with that paper, we prove that we can do telepsychiatry. That paper proves that it can be done. Because if you're going to look before that, you cannot find any reference for an actual performance of telepsychiatry in the country. So with that paper, it shows that it can be done.
Alright, for the second paper, the acceptability of telepsychiatry in OFWs in Kuwait, it involved a study with a different setting. The first study was in the Philippines and involving Philippine culture, but this time it involved a different setting, a different country, and for obvious reasons, different cultures. And it also was a success, and it really proved that in that specific region, the acceptability of telepsychiatric care is also feasible and is very much needed for our OFW countrymen.
Ayun. I think both papers, no, I think the result is, yun nga, sinabi na ni Doc RJ, it's a success. So, in terms of bakit nyo po naisip or paano nyo na-formulate yung idea to go into these two researches, ano pong naging push nyo or stimulus, kumbaga?
So for yung sa PMC, yung first paper, actually ang start doon is kasi yung Cagayan de Oro City, they are asking help sa Southern Philippines Medical Center to manage their psychotic migrants. Yung mga psychiatric patients andun sa daan, yung nakikita mo natutulog sa daan, no? So those are psychotic migrants. So taong grasa. Mga taong grasa. So yun ang nilapit ng city government of Cagayan to us, asking assistance from Southern Philippines to help them manage this population. Initially, they send their patients to Davao from Cagayan, traveling around 6 hours in one way. No? So halos 12 hours lang, back and forth yan. No? Bringing in patients several dozens. No? Isang bus load. No? And they did that for a couple of months. Ang nangyayari, every trip is a disaster. No? Isipin mo, okay lang yung mga follow-up na patients na dala nila. Pero yung mga bago talaga, unmedicated patients, galing sa daan, unmedicated, sometimes hostile, walang ligo, babaho. So, pag ipasok mo yan sila lahat-lahat sa bus, imagine anong mangyayari sa bus. No? So, yan ang situation nila for several months. Then after that, we strategize, no? And then so ako nang pumupunta doon. Then it is also a big waste of time yung transportation period. So to address that, kasi that was 2015 yung ang conceptualization ay pumapasok na kasi yung concept ng telepsychiatry in the first world. So, kaya we proposed the concept to our medical center chief, Dr. Vega, Yusik Vega, no? Kasi siya yung former na medical center chief ng Southern Philippines Medical Center. So, he approved on the idea na to test the waters for yung time na yon. It's just testing waters kasi wala pang gumagawa eh. Wala kaming area na mapuntahan para mag-benchmark, no? What we know is ano yung existing literatures based on the first world. So locally, nationally, walang baseline. So we tested waters, we experimented on it. So yun na nabuo yung idea ng telepsychiatry in the local setup. No, na kasi we have to strategize and find solution to the present problem at the time, no? So actually, it is a problem. Sometimes now you can the same problem is still there in different other areas, naman, no? Kasi yung Cagayan na project 2015 until now up and running pa rin siya, no? Up and running program siya, no? So the telepsychiatry initially we plan na dapat Cagayan de Oro City people lang yun ang i-cater namin, but we cannot stop people from other areas, other LGUs to come. So, yeah, welcome na lang sila, pumapasok na sila. So, that's telepsychiatry in our local setup, no? Yan ang initial burst bago pumunta kami sa research site.
So, ayun, there's a need, basically. Yun po ang ating kita. Nagkaroon tayo ng need that entails or that needs na parang kailangan ng solusyon.
Kailangan
i-address. And unfortunately, yun nga po, it's very a part of our culture to see yung sinasabi po natin ng mga taong grasa sa streets. Merong pangit na connotation, kumbaga, yung mga ganong tao. And hindi natin alam yung pinagdaanan nila, and to have them have the help they need is very timely, kumbaga. Kasi wala naman, parang growing up, walang pumapansin sa kanila.
Oh, actually.
Walang nagbibigay ng attention. They're just there.
Walang nagkaka-initiative to help.
Yes. Oh, parang it's nice na, although hindi rin nice kasi parang kailangan pa na dumami yung ganong cases for us to act upon it. Pero that's a really good start na parang yun yung naging rason para magawa nyo po yung study na to. Okay. So how about the second paper po?
Yung dalawang papers yun, yung Borja at saka wife. Okay, so we have done the local implementation, and I was advised or encouraged by Department of Science Technology. One of their theme is mental health. And it's because we have done our homework, then the ORCP. That's our help if we can do it with OFWs. And I was an OFW before. I brought my family. I was working in an American company, and I've seen the sufferings of Filipinos in the Middle East. And it gives me the encouragement to do it. And I thought by the grace of God that they have the funds and they're willing to put in seed money for the research. So our journey with telemedicine, specifically a telepsychiatrist, just like we walk, we run, and then we fly. Again, the Oro City actually also done telepsychiatry in Mati before quiet, and then moving forward to Saudi Arabia. So it's something which is, again, this is the first time in Philippine history, telemedicine outside our country. So it's in line with the universal health care and mental health of our country. And
Yes.
people are telling us it's just like shooting the moon. Yeah. So, but it happened, and it gives us more motivation because we have seen the sufferings of our OFWs, which we call them heroes of our modern times. And then what? They're suffering, and who's gonna do what? We will do something for them. It gives us more encouragement, as what I've said, Dr. Laika say a while ago, that we bring in all the players that are willing, psychologists, psychiatrists, private NGOs, and government stakeholders to be able to move on. It's just a vision, but then we managed to do our homework. So, kumbaga, we have already reached the river. We just have to cross the bridge to do more for the OFWs.
So, the implementation is parang offshoot ng inyo pong study sa Cagayan de Oro. And the choice to have it applied to our overseas Filipino workers is actually very commendable in a way. Kasi, yun nga po, may experience po kayo, Sir Greg, as an OFW, and you have seen some of our fellow countrymen abroad that are suffering. So, ang ganda rin na na jumping off point doon sa pagpapalago or pagpapalawak ng discussion when it comes to mental health. Kasi maraming ako rin po, kasi child po ako ng OFW parents, hindi ko personally alam yung struggles nila. Kasi syempre, magulang hindi naman yan magsasabi sa anak na napapagdaanan nila eh. So, growing up, hindi ko alam na ganun siya kahirap. I just know that my parents are providing for our family. Pero, growing up and having seen news na may kinalaman sa OFWs natin, and ngayon na mas naiintindihan ko na, it's really hard. It's taking a lot of mental stamina, kumbaga, for lack of a better term, na parang to keep themselves occupied at hindi mag-iisip na kung ano-ano abroad, lalo na malayo sa family. So ayun, so thank you po for that initiative. And follow-up question lang po, bakit po sa Kuwait tayo nag-sample ng OFWs? Ano pong reason natin doon?
Okay, the reason as to why we started in Kuwait outside the country, supposed to be, it should be in Saudi Arabia, because you know exactly that the heart of these mental issues is in Saudi Arabia. I was talking to OWA, which manages our OFW, but the directors told me, Greg, Saudi Arabia area is so huge, and we're not talking of hundreds, right, but thousands of those OFW. So why don't we start with white cheating? I told them we can do it in Saudi Arabia. You just have to hit the heart of the problem. But they said, are we sure that the killer ran? People, I'm pretty sure we have done it in the Oro City, in Mati City. For as long as this internet, our team is ready. They're experts in their own fields, IT and medical field. But is it, we still have to strive like a pilot in wipe and we see if it's acceptable. And I said, okay, I'll go with you. Acceptable, and then not so much, and it's only 3 main, then we'll go for it. But I promise you, by the grace of God, it will run. And then we're going to move forward to Saudi Arabia. And they said, okay, let's have a deal. So we did it sometime in 2021 for a year, funded by DOST, and it was acceptable. And therefore, I told him, you see, so we're gonna go to the heart of the problem. Do you have the money? And the UST said, yes, we have. Then, we made things happen. So, ongoing yung Saudi namin. 2 years project. Tapos na kami ng 1 year. Okay, and then we're heading towards the second year na. DOST funded pa rin.
In addition din po, at that time, si Kuwait, 3 babae na po na Filipina yung namatay at the hands of their employers due to bad treatment. It was that time na po. Actually, their first names start with the letter J. We should write their names in stone po talaga because it a lot of things happened. Even the government had conflicts about it. But yun din po, OWA, our partner with our study, they also decided to start with Kuwait kasi marami na rin pong na-distress at that time due to the death of that Filipina.
Oo, medyo parang big, hot issue siya noon. Na parang, it's a very big deal na parang lagi na lang yung ating countrymen ang na OFW ang nababalita for a period in time na parang sunod-sunod siya, and it's very alarming na I could only imagine the people na nandun talaga sa Kuwait, the stress and ayun, kailangan nila ng makakausap and kumbaga hindi na basta parang hindi na sila mas stress or at least mapalatag yung kanilang loob.
Doing your research, ano po yung mga challenges na na-experience niyo habang ginagawa niyo siya, yung mga papers?
Ang sa challenges in doing the research, actually, because we ran initially the telepsychiatry sa Borja, that we saw the challenge. Now, the biggest challenge, I think you all know, yung funding. So yun ang biggest challenge talaga namin to start. And then at that time, wala siya sa lens ng DOH, yung telemedicine. So hindi siya sa lens. So we cannot get a fund from DOH itself para to mobilize the telepsychiatry to make it a program. So maging program siya. So wala siya. So me and Sir Greg, we look for ways, and then here comes the UST na meron silang annual funds binibigay. So we nakikita namin na this is a good ground, one is they have the fund that we can use, then so masosolve yung funding problem namin. Pangalawa, walang data, walang publication, so that will also hit another bird. So doon from a problem of funds, so we hit 2 birds sa pag-develop na. So now nandun na yung funds, nandun na yung research, yung initial grant. So again, ang nakikita naming problem is yung how to make it run talaga sa telemedicine, kasi from that way experience different classes of patients, na we realize na dapat pala kasi initially lahat pasok. then we realize na pag sobra na talagang agitated yung patient, hindi talaga pwede din mag-online. No? Kasi masisira yung monitor namin. No? We experienced that, no, na pinasok yung isang patient na hostile masyado, sa nangyari, nasira yung monitor. Sinuntok ang monitor. So yun yung mga challenges namin, learning experience. And then considering na wala kaming makahanapan na matatanungan na kung ano ang gagawin, because that was the first time, so we learned from our mistakes. No, so step by step we have so many we encountered so many issues, so we learned from those issues. No, so yun yung ang nangyayari sa Borja na project.
Tapos yung sa Kuwait naman po na study, since I was the project officer of that project po, ayun na nga, nag-shift na tayo, no, with overseas na tayo.
Yeah.
So, mas malaki na yung, mas complicated na siya. So, siguro we found, to summarize it, mga 4 ko siguro na problem. So, the first one is, of course, since malayo na sila, akala natin mabilis yung internet nila, pero in the shelter itself, internet connection was also a problem. So, meron pong time na makat po talaga or parang ma-disconnect sila, but only for a few seconds. So, yun, mawala sa momentum yung patient. And then secondly is, syempre ibang country po to, Middle Eastern country. So, we have to also know about their laws. And their laws sometimes restrict how the therapy or the consultation will happen. Like, for example, yung mga drugs available doon, or kung ano yung mga bawal at hindi. At the scope of the study itself na syempre it's a study hindi siya implementation lang. So talagang may limitation siya in terms of the intervention. And then the third is the on-site personnel. So ayun nga, the medical personnel, complete kami dito sa Philippines, but there, kailangan siya merong on-site na allied health po sana. So initially, we had a nurse partner po doon provided by the OWA, but later on, he had to be repatriated na. So yung naiwan na aming on-site person was an IT na po, hindi na siya medical staff. So medyo nahirapan siya on how to follow parang do patient education after the consultation, kasi syempre i-reiterate niya pa ano yung mga kailangan gawin ng patient. And then lastly is the scope of the research itself. So since it's just a research paper, may limitation lang yung time. It was only a 1-year project, extended nga lang siya ng about 2 months. So what and apart from that, these were Filipinos in the shelter, no, the resource center, who are waiting to be repatriated to the Philippines. So, meron lang mga 1 or 2 sessions na magawa on our side, and when they go back to the Philippines, wala nang follow-up because that's beyond the scope of our study. And yung iba are far from the OFW hospital. Since our OFW hospital is only in Luzon, wala nang other parts of the country. So, yun po yung mga limitations of and the challenges that we found.
When talking to your patients po, ano po yung naging platform ninyo? Kasi syempre marami na po tayong video messaging or yun.
Teleconferencing
apps na available. So ano po yung naging main na platform na ginamit ninyo?
Okay, so what we did was we hired analyst and programmer as well. I'm in IT profession. I'm an IT specialist from the ground, programmer, analyst, IT manager, and IT director in a call center. So I manage them to develop a system as cloud. Sitting in our private cloud, the Southern Philippines Medical Center, we have a 105 million data center. I think that's the biggest in our country, in a hospital. So that system, the nurse in Kuwait City can enter remotely all those personal information, demographics of the patient before the doctor will do telepsychiatry to them. So that even before the session will come, the doctor will be able to see how many patients are in the queue, what are their demographics or profiles, what are their uh, history, you know, so that by the time the doctor will talk to the patient, meron na siyang idea. So uh, that was created uh, in a secured environment. So we had set up a hardware, a software, and a liveware. The liveware is combination of IT expert and also the doctor. And I am the data protection officer, and I know exactly uh, what
Oh,
the data National Privacy Commission needs in terms of compliance to the Data Privacy Act of 2010, kinatawag natin Republic Act 101 to the degree. Talking about the confidentiality of the personal information, sensitive personal information, is PI. So, meron kaming data center na well secured kahit i-armalite or ano for terroristic act, secured yun. Meron kaming multiple firewalls, encrypted yun, HIPAA compliant, pagka sa US pa. And make sure na we complied to the National Privacy Commission, and we have to uh, make sure na secured siya, and confidentiality yung yung platform namin is was designed to make that happen. So meron din siya after a few minutes, pwede siya mag-shut off. Meron ding audit trail kung yung hindi ka authorized to that kind of module, then malalaman din namin, kumbaga. So, with my experience, 14 years in IT industry, sa college pa, as a scholar in a university, so I know exactly on what to do with the system, especially SPI is a sensitive personal information. So, yan yung fun namin. It's sitting in a private cloud. Both the the nurse and quiet and also the doctor in Davao City, half the distance of this world, accessing the platform, online system. So yun pong nangyayari. And it was very good.
so kumuha pa pala kayo ng own na platform to conduct the telemedicine. So, ang ganda. As very, very big din ngayon yung data privacy nga,
Yeah.
especially when it comes to medicine. Kasi parang, di ba, may anak po tayo or patient, doctor-patient
Confidentiality,
confidentiality.
yes.
Mga ganun.
Oo.
So, nagawa.
Tsaka hindi siya basta-basta mahahack in. Walang makakapasok na iba na sure tayo na secure yung usapan, walang information leak at walang kahit na nung anomalya with regards to ng data privacy, yung paglabas nga ng data. Okay? So, we have discussed yung challenges. So, ano naman po yung mga memorable experience ninyo while doing this research? Kumbaga, yung good experience, bad experience, or yung like pinakapangit na experience nyo?
With the Kuwait study was really a very a heartwarming moment. Each session that we had for our kababayan. Alam mo yung presenting them with an opportunity to share what they have got through and letting them know and letting them feel that there is an agency that we be willing to listen to them, who's caring for them and who's trying to find ways to help them beside the system na visual nito. Malaking tulong na ito sa kanila. Sabi ko nga sa kanila, kahit sa konting panahon ng ma'am, sir, sana makatulong kami. And they get to pry, they get to vet out kung they had been through, some of them, the worst of the worst. Kita mo yung resiliency ng human spirit, ng kanilang pakikipaglaban. Makita mo, just an amazing experience. Happy ako I was able to help them. For in fact, more than what I was able to offer to them, they also made me feel, made me realize some things on my, there's still more to be done for them. Yun ang mga amazing experiences. Nas, memorable. It's also good that you ask about the negative things. Siguro I might say na hindi naman purely negative, but to put it more upbeat, there's room for improvement, much room for improvement in terms of budget allocation, uh, manpower provision, and also for the system to be more in the flow of the system, mas user friendly to mas responsive, mas
Yeah.
faster because we were dealing in with OFWs in the Middle East, so we need to readjust our system according to their culture. Some may have restrictions different from ours, so we need to readjust. So yun ang mga temporary setbacks that I encountered when I was dealing with these scopes of.
How about po yung iba po? Baka may iba pa po
Opo.
kayong experiences na personally medyo okay, pangit to for me, or ang gandang experience nito for me.
It was, I think, close to 30 years ago. Okay. And I did not dream to work in a hospital. Okay. I was
Nag-freeze.
in a food industry. Okay. That you know, Franklin Baker Company of Utilities, makers of desiccated coconut under General Foods Kraft Cheese merger, and was bought by Philip Morris Group of Companies. Nasa Davao City yon. So I was the before IT manager, and then 10 years ako doon, and then I was hired by the number one fabrication and engineering company in the whole world, based niya sa New Orleans, Louisiana, McDermott International. Okay? So we build oil rigs for oil exploration, ships for US Navy, and boiler for power plants. I was one of their ED&M, application development and maintenance manager, and then was promoted to IT project manager, implementing systems around the world. So, number one fabrication engineering, malaking kumpanya. And my children was there sometime in 1995. I was renewing the passport visa in Abu Dhabi, Philippine Embassy. And then when I was there, wala pang uwan noon. And then I went to the comfort room. Merong 2 kwarto, puno ng Filipina. Okay? And then I was amazed. The doors were open. One was shouting and crying, and the other one dumubulong na umiyak din. Puno yung 2 kwarto. And I so happy na Consul General taga Davao din. He talked an hour lang. I asked him, hey Consul, what's going on? There are 2 rooms out there, and one was shouting and crying. The other one was umiyak din. And sabi niya, alam mo Greg, yung isa doon, narid ng Arabo kahapon lang, tapos lumayas. Yung isa doon, binugbog ng Egyptian, and then umiiyak din. And then I asked him a big question. Where is your psychologist? Where is your psychiatrist? And mental issues yun eh. And he said, wala nga Greg eh. This is one of the problems that the government haven't solved for the longest time. And then knowing that you are an IT expert working with Americans, maybe one day, that was 30 years ago, maybe one day, if you have the solution to help them using technology, please, I pray, I beg, please help them. It's still in my heart even today. I told my wife, I haven't managed to sleep for several days. But God is very good because I prayed, Lord, how can I help? I am not in a hospital. But maybe you can find a way one day. To make the story short, it happened. And they are asking me, Craig, bakit talagang Ano ka, dahil ba OFW pa, saka ano, I've seen it in my own eyes. Okay? So, and that's why, when we started this Saudi Arabia, it was approved. The US's protocol is when the submitted proposal is approved, 2 years pa yan bago mabigyan ng funding sa dahil naka-view maraming halos 10% lang ang ma-approve. So, and I told them, 2 years is too long. Can you set an appointment to the highest ranking officials at the US of Hunter? And they did. And I talked to them. I was facing the EXICOM, siguro mga 12 directors, ASIC, music, and secretary. I think it was either De La Piña or the new one, Solito. And I told them, for me, I cannot accept that the implementation for this telepsychiatry for those that will take so long. Okay? So, think about this for a while. I'm gonna pass the ball to you. We do not know that today, tomorrow, the day after, some of them will commit suicide. And I told them, their blood is in your hands. And I look at their faces, all of them, one by one, so silently, but my eyes were towards them. And the secretary told me, how much is the cost of this project, Greg? And I told him it's only 13.26 million for 2 years. Very cheap. I fully understand you have 300 plus billion given by the government. And the next question was, are your team ready, Greg? Oh, yes. The ready as of yesterday. Actually, it's 2 years because we have done our homework. And he said, let's do it. You see? Because I fully understand every rule, there's always an exception. We cannot also make the exception as a rule. We're dealing with life and death. And I told them, this is now a great opportunity to help them. We call them heroes, right? And then what? Nobody cares for the soul. Every single soul is so precious for that. Okay? And kaya nasa puso ko talaga yon. I told my children, please help. Please. And not only my children, my doctor, please. I see it in my own eyes. And they're waiting for the longest time. And I told the officers of the UST, the exit from your names may be written in stone. Forget about me, but please, help them.
Thank you po for sharing that very personal story. Sobrang kitang-kita ko na kung saan nanggaling yung hugot nyo para dito sa dalawang paper na to. And it's really, really important na parang faith ang nagdala sa inyo na you have encountered that particular scenario ng mga OFW natin na Filipina na may mga ganong bad experiences. So, you were the one that bridged para makatulong para sa ating mga kababayan sa abroad. And thank you very much, sir, for sharing that wonderful story kasi it's really yung totoong storya ng nangyayari sa mga OFW natin. It's not really just pang teleserye na scripted. It's really happening and it's sad. Mabigat pero ayun po.
So, for everyone po, what are your plans moving forward with this type of research?
We plan to continue doing our work to give justice to the OFWs who have been suffering for the longest time. Kailan pa ba tayo mag-a-action now? When will we take action? So now is the time to show them that we are here and we care for them. And so we just finished our stakeholder engagement meeting this morning. We had about, this afternoon. We had members from the National Center for Mental Health, from the OWA, from the ICT, from DOH, from PhilHealth, from advocacy groups. We were about 40 in attendance. And seeing a room full of people who have this passion, caring for the OFWs is so heartwarming kasi kumbaga, kung kami-kami lang we cannot do it. Alone we can do so little, but together we can do so much. And so for our goal is really to institutionalize telepsychiatry to integrate it to policies and programs for OFWs, starting from pre-departure, meron ng mga programa, as well as their benefits in terms of sa PhilHealth. So we're looking at all of those aspects, but again, we cannot put it alone. We need multi-sectoral, disciplinary partnerships, and to determine a patient-centered approach. There's also capacity building that needs to be done. Parang ang dami pang steps. Phase 1 pa lang kami. So we need all your prayers kasi kaya nating to, no? We have to give our OFWs or kababayans justice, and mental health is the right of everyone. So, yun po, our future direction is to continue and publish more, and we thank the OSTPCHRD for supporting us in terms of providing grants.
In addition to that one, we had done it in quiet and in progress yung Saudi Arabia. Pero land-based yun. One of the many challenges that we are facing is maritime. Yung mga seamen, mga kapitan ng barko, somebody came to me, Kapitan, Greg,
Yes.
matindi na rin yung suicide doon sa maritime dahil ganito. What's the difference 20 years ago? Now, bakit mas maraming yun? Dahil ngayon, Sir Greg, online na. Dati sumusulat kami 1 month pa bago makarating sa Pilipinas. Ngayon, iba na. Okay? Dahil nga may internet na yung barko, meron makarating na mga yung misis mo, ginawa ng kabit ni so yung anak mo, nabuntisan yung isa, dadadig na tukhang, namatay, blah, blah, blah. On top of the other real time, hindi na makayan, the jump ship, and they die. And they said, there are higher ups, mga puti ko, na they are talking to a doctor in a computer, and they live na telepsychiatry yun, so hindi sila kasama. And we do that for us, and like, why not? Well, I cannot cut my, body. We need a lot of people. So isa yan sa tinitingnan namin moving forward. And that's why we bring in a lot of stakeholders from different governments and private NGOs to help us. And then, at the end of the day, ang bottom line is to tell the lawmakers, Congress and the Senate, na dapat mayroong bill, institutionalize to, so that whosoever sits in the throne, he will have to do it because meron ng law and the Congress needs to provide a budget, ilang millions and billions pa yun, every year thereafter para to be able to fund all the resources, as I mentioned a while ago, the hardware and the software and the library, the people, and the project management who gonna handle all, because project management team will ensure project success. And therefore, we're gonna hit DOH goal. Financial protection should be free. Second is responsiveness. They've got a problem. We're gonna just respond ASAP because it would be a 24/7 operation, just like what we did with radiology in BARM. Ganon din yon. And then, quality healthcare services. If we're gonna do all these things, we work hand in hand. We're gonna hit those 3 goals na sinet at ng Department of Health, in line with the universal healthcare and also mental health app of our country.
I'd like to add din po about that. Yun nga po, actually nga po, yung both the studies that we're discussing right now are written in a positive mode po. So, telepsychiatry is acceptable, ganun. And then, the utilization of telepsychiatry is also a success, parang ganun po. But what we do not know is the backstories of those OFWs. And sa totoo lang po, when we knew about their stories, nakakaiyak po talaga at nakakagalit. Kasi why are they doing this to our Filipinas who are just serving their families, no? And who are being a part of their family. So ganun po talaga, nakakagalit po talaga.
Yes.
Which drives us even more to not just expand to OFWs, but to expand telepsychiatry in general. So, our team is working on 3 aspects on what we're gonna plan next. So, for this current project we have, the Andito project, it's a telepsychiatry for OFWs, which we did a while ago. A stakeholder meeting po muna so that we can ano tawag niyan, we can gather the insights of others so that we can make the policy brief. So policy po so that ma-integrate si telepsychiatry in policies and programs for OFWs. And the next after that is to make research paper. So in my case, since I'm part of a research institution, so I also have another study on telepsychiatry which we can expand, but in Southern Philippines na po siya, and which involves tawag nito, mga youth na naman, youth, adolescents, and their mothers. So ganun po, ma-expand po sana si telepsychiatry. And third, what we can do is to collaborate with the other agencies, which we initially did na rin po kanina, because we were also talking with other research institutions, and our idea was to make a Filipino version of a psychosocial screening tool pre-deployment stage. So yun po, promise po ida sa kanila na to collaborate and to ask the researchers to make a research paper on that, kasi kulang po yung pre-deployment orientation. It's not enough. It's not so comprehensive to make these OFWs more resilient. And the psychosocial assessment data is not uniform, no? And it's not also readily available to whoever needs it. So, ganun.
Ayun.
Actually, parang, especially now na sobrang, parang may mental health epidemic, ganyan, or, di ba? Parang sobrang daming kailangan ng support right now. Sa academe pa lang,
Yes.
medyo marami na rin, di ba? Sa academe pa lang, because of all the stress, because of those things, ganyan, ang dami lang
Because of
kailangan
the pandemic.
na help. Yeah.
Yeah.
Also the pandemic as well. Like, right after the pandemic, nung paglabas natin, even during the pandemic, lalo na. So, ayun, maganda nga po na ma-expand pa ang telepsychiatry.
Yeah, ayun, to echo on that, yung institutionalization ng ganitong type ng screening and psychosocial evaluation, lalong-lalo na nga, yun nga po nabanggit nyo sa OFWs, medyo kulang talaga, and we really need it right now, lalong-lalo na hindi naman nababawasan ang OFWs natin, bagkus ay lalo pa siyang nadadagdagan dahil sa, aminin natin, kakulangan ng jobs available dito sa Pilipinas. So, ayun, di talaga natin maiiwasan, and siguro nga, kailangan nating tanggapin that our primary export are our fellow countrymen. Pero, at the same time, we need to take care of those exports kasi tao rin sila. Yan, at the end of the day. So, yun. Okay? So, before we let you go, Doc, Ma'am, Sir, ano po yung pwede nyong advice sa ating mga aspiring researchers, aspiring doctors, aspiring IT professionals na nakikinig at nanonood sa atin ngayon?
Word of advice sa aspiring researchers, no? So, for me talaga, no, if you do sa research, minsan sa ating setup, no, mahirap yung facts. No? But ang kailangan lang talaga natin is the motivation, the interest for doing research. No? Kasi pwede naman kahit tayong gagawa ng research, no, with limited funds, no? We manage with this project, no, initially sa Borja, walang lumabas na funding support. No, but the eagerness to be is there, no, with the interest to make it move, no. So yun yung kailangan. So for young aspiring researchers, no, kailangan lang talaga sila, they have to make one step at a time. No, mahirap mag-run. Mahirap tumakbo. In terms of research, mahirap tumakbo. No? But kailangan lang sila one step at a time. Matatapos din ang research project. No? And then after you finish a research project and you realize, okay, may another run na naman, another goal na naman. No? So for those aspiring, I am praying na hindi lang siya yung research pang academic requirement.
Yes.
No? Na hindi lang siya na gagawing thesis, dissertation, and after that, nakahanger na, tapos na.
Mm-mm.
No? I pray na they continue to be productive. No? Yun yung kulang natin is we need to generate knowledge. We need to generate information that is good and that is fitted to our setup, to our culture. No? Yun ang kulang natin. Many of our information is based on first world countries,
Yes.
based on other cultures. Wala tayong data para sa atin. And the information, the database or the data set is out there in the field. Kulang lang talaga ng workers. Kulang lang talaga ng researcher. So, we are praying, our team is praying na dadami ang mga young researchers, young aspiring researchers.
Yun pala yung sasabihin ko dapat yung saan, yung sa translating into policy,
Mm-mm.
ng research, and as well as yung pagkakaroon nga ng sarili nating parang parameters to
Mm-mm.
measure our psyche, etc. Ganyan. Kasi nga, iba nga yung kultura natin from Westerners, for
Yes.
example, na ginagamit na parameters ngayon, di ba? Ay, so, sorry. Ay, so, may pa po ba advice pa po for aspiring researchers, doctors?
Sa akin, sa mga, especially young researchers, they have to embrace technology. It takes two to tango, no? Kailangan natin ng doctors, but of course, kailangan din na ng IT. And then they have to see exactly what's going on in the world-class countries, no? Because otherwise, somebody will do it. We're gonna be left behind. Okay? So, mabilis yung takbo ng technology, no? So, kailangan, although we are doing an 80-20 principle kind of implementation, 80% is acceptable, 20% through improvement. Pero, yun na nga, IT is something that is so helpful, especially sa mga psychiatrists natin na they are only less than 600 out of 110 million, imagine. And then majority of them is in the private practice. And we know exactly why it's like that, no? So their time is so precious. Therefore, we in IT needs to do something to use technology to increase their productivity. Ano? So we cannot get away with technology. Hindi tayo makalis ng bahay kung walang cellphone. Okay? I was talking to the Ministry of Health sa Israel and they are telling us, Greg, you use the wearables. No, malalaman mo na doon yung parang wilo ng BP mo, mga heartbeat, etc. So marami na. Mayroon ng mga portable na mga x-rays, so it is. So I can envision that one of these days, no, or years, every Philippine embassy/O will have telemedicine. It's a huge umbrella that has several pillars: teleconsultancy, teleradiology, teledermatology, telepsychiatry. You know, mas cheaper yung telepsychiatry. For as long as meron kang laptop or cellphone ba, you can do it. As opposed to radiology, na mahal yung mga gadget, medical equipment. But it can be done, you know? So, political will lang talaga. You can just imagine if you're an OFW, kung meron kang health issue, you can go to Philippine Embassy/OWA. Hindi ako makatulog kagabi. Okay, room number 1, telepsychiatry. Okay, parang ni, yung kuwang ko, skin problem. Room number 2 is teledermatology. The professional doctor is in our country. We fully understand as per agreement in Geneva Convention ba yun, na we Filipinos, Filipinos can exercise our profession in the Philippine Embassy, remotely or physical, because that's our own territory. So po pwede siya. The government is telling the OWA, the MW na to provide services, not only legal by default, but also medical. And this is now the opportunity that we can do it using technology po. So embrace technology. That's a one-liner, but it's so important for the researcher.
And then siguro lastly po, on my end lang po, for aspiring researchers is to really find your passion, no? As Dr. RJ said, yun nga, find your passion and work on it. Kasi I've learned also in one of the seminars that I attended, the speaker said na move like a horse in the chessboard. Like the horse piece nga. Kasi nga, di ba, we have the tower, no? Dire-diretso. We have the king, kahit saan. We have the pawns who can move forward, ang bilis, ganun. But the horse can only do small steps in an L shape. So move forward but to the side. So parang the analogy of that thing for aspiring researchers is move forward. Okay, you made a proposal, you made your own research paper, but move to the side in which you have to learn as well. So educate yourself, take seminars, no, or enhance your education, kanon, so that you can so that in the next step, make ka na naman ng proposal, but also continue to enhance yourself so that you become better at the same time. Because like the horse, you can also go back to your roots then. So when you go back to your roots, go back to serve also where you also came from. So lumingon ka rin where you came from. Salita lang po.
Last.
Asik.
Last na talaga in a spiritual arena. Honestly, I anchored my word to the one-liner commanded by God, to love Him above all and to love others as God has loved us. Sino yung others? Mga OFWs as an example, they've been suffering for the longest time. And then, Ecclesiastes chapter 9 verse 10, written by King Solomon of old, whatsoever thy hand findeth to do, do it with thy might. Nagtrabaho ko man lang, ayusin mo na. Because all of us will live in this world. Kung wala na tayo sa mundong ibabaw, okay? So we cannot do anything under the sun. And therefore, while our feet is still touching the ground, we're gonna do the best that we can. And then we're gonna face our Creator one day. You can hear the words coming from His mouth say, well done. Well done, my good and faithful servant. So yan lang po. Thank you.
Ayun. Thank you very much po for all the words of wisdom. Yung ilan dito parang, ilan po sa sinabi ninyo, parang kailangan ko ding marinig. Parang medyo na-empower din ako ng konti. Ayun. So, do you have anything to promote po ba?
Siguro po, just on collaboration. So, whoever has the ideas po or the means to integrate telepsychiatry further or the services that they can offer whenever telepsychiatry can be institutionalized, of course, they can contact us. I think ma-show naman po in the the description of the video.
Yes.
But if not po, we are from sa Southern Philippines Medical Center and Davao Medical School Foundation po.
One of the vision that I have is to integrate telemedicine in medical school. Kung mga nag-aaral ng medicine, na dapat third year, fourth year, meron ng immersion so that when they graduate, they will not be facing a blank wall of what telemedicine is all about and its implementation. That's one. Second is sa mga universities na mayroong IT, dapat marunong na sila mag-program, tapos magaling na sila, and then they're gonna work with the local and international companies na yung actual na implementation. Hindi lang yung theoretical, so that when they graduate, they will become productive. Dire-diretso na sila, as opposed to, paano ba to? Puro theory lang kami, Sir Greg. What's telemedicine? So, the problem there is we have to train them, as opposed to university will train them before they gonna do the actual work. So, importante yan. Kung sa preparation, a work well planned is a work half done. I told the universities about that. Dahil consultant ako sa isang university and asking me, Greg, what can we do with technology? That's the one. Meron kayong parang laboratory na immersion na, local, international, so that parang aside from its marketing, this is the only university that when our students will graduate, hinog na sila. and they can be ready for war or ready for systems analysis, design, programming, testing, and support. So, productive na sila. Supposed to, Sir Greg, can you please train us, blah, blah, blah. So, that's all for me. Thank you.
So yung integration to the curriculum po ng telemedicine is part of the project na po nilanta.
Oh.
So we're gonna work on it po on January. So yun po, if anyone who wants to collaborate po, we have
January what year?
this year.
2025.
Po. So yun po, for collaborations po, feel free to contact us in Davao Medical School Foundation.
Ayun. So, ayun nga po, as we were saying, if you want to collaborate and you're very much interested with this line or with this field, yung ginagawa ni na doc, ni na ma'am, ni na sir, do not hesitate. We want to expand this research outside Southern Philippines and explore pa Luzon, Visayas, kahit all over the world, hindi lang Middle East. Kasi, ang daming natutulungan nung research nila. So, if you're really interested, go, push, contact nyo na agad sila. Yes, and hopefully, sa future papers po sa uulitin. Sige po. More power po. And good luck and Godspeed po sa inyong ginagawa. Thank you very much po.